in Dr. Malika Marshall now. And Doctor, let's break it down. Let's give people at home the simple do's and don'ts when it comes to protecting ourselves against coronavirus. We saw the Secretary of Health and Human Services saying in that news conference today, wash your hands, 20 seconds, really scrub. So that's one thing you can do. What about stocking up on cleaning products?
So we do think that cleaning products might be helpful.
Okay.
The coronaviruses in general, we don't know specifically about this one, but they do tend to be pretty sensitive to disinfectants. So, you know, you want to clean off surfaces that are commonly used by multiple people, but you don't want to go overboard. The main threat, again, is sick people who've been coughing and sneezing. So the best thing to really do is stay away from people who are sick and hand wash frequently.
If you do stay home, or if you have a fever, you should stay home. That's clear.
That's right. And, you know, we've talked about this before, but you should probably plan on being home for 2 to 3 weeks.
Wow.
You don't want to go out in public or use public transportation if you have a fever, because you want to help the community limit the spread of germs.
That's the self-quarantine that we've heard about, right? What if you do get sick? I'm assuming that you go to the doctor right away?
You do not.
Do not?
Do not. So you do call your doctor.
Okay.
If you have fever, cough, shortness of breath, you want to get advice. You want to find out what you might need to do, whether you need to be tested, if you do need urgent care. But you don't want to go straight to your doctor's office, an ER, and urgent care if you develop symptoms, because you're putting healthcare workers and other patients at risk. So if you do have to go in an emergency capacity, make sure you notify the front desk right away that you think you might have coronavirus.
I feel like people are starting to calm down a little bit, and that's one of the biggest don'ts. Do not panic.
Do not panic. Do not get overly anxious. I really want people to take a deep breath, because there will be a surge in reported cases, because we are going to test more and more people, but the risk to individuals is still low. Again, kids seem to be at low risk, which is great news for parents, and most people don't seem to be getting very significant symptoms. However, don't go places with large crowds if you're at high risk. So if you're over the age of 60, if you have a weakened immune system, lung disease, diabetes, you should probably avoid large crowds.
Which are basically the same rules for the flu.
Exactly.
Right? Yeah. And as always, stay informed. Keep reading up on the latest developments, I'm assuming.
That's right, because this is a rapidly changing story. You want to pay attention to major news outlets. You can also go to the CDC and the WHO, but don't rely on unreliable sources of information, because there's a lot of misinformation out there, unfounded claims, conspiracy theories. Stay away from social media, and, you know, there also are some products out there that people are marketing, saying that it's going to prevent you from getting sick, or it's going to treat you for the coronavirus, and that's not true. So buyer beware.
I do like to use hand sanitizer, which has been really hard to find these days.
It has been. I'm hoping they're going to get some more shipments.
Doctor, great job. Thank you so much. Really appreciate it. Paula, over to you.